Okay.
So my patient is Jeff Haversack, and today we're going to review home care. So Jeff, have you been flossing your teeth?
Yeah, usually.
Okay, so now we're going to look at the gums and see how well he's flossing. So when you see inflammation between the teeth, it's a sign that the patient is not flossing properly. So we're going to go over the flossing technique and improve his technique. And in the process, we see there's a lot of calculus going on. So my patient has not been so responsible.
Diligent. He hasn't diligently flossing.
Exactly. And the problem with that is that this accumulation of calculus, which is called calculus or tartar, it stays on the gums, underneath the gum, because bacteria likes moisture, warmth, and darkness. And so when it has that particular environment, it just piles up and piles up. And since the patient seems to be in very good health, there's no gum disease involved yet. But if it continues, it can definitely create some inflammation. So it would start with like gingivitis, which is the first stage of gum disease. He has a little bit, but it's very minor. So today what I'm going to do is modify his technique, because he does floss, as he's saying. Like you see that he's flossing, he needs to improve his technique and make sure that he does it more frequently on a daily basis, ideally twice a day. If this was to progress and the patient had an undesirable diet, which would mean that he eats a lot of carbs, which becomes sugar in the body, that would create a major problem, because that's how you can develop periodontal disease. Periodontal disease is a type of infection that packets form in the mouth, and it can migrate to the ligaments and bone, and you end up losing bone. You have deep packets. So we want to prevent that, because Jeff is an individual that practices health. So in his case, it's not going to happen. So this is a good idea that he comes routinely to get his teeth cleaned as a preventative measurement.
Got it.
Yeah.
So you say it's good for someone to come to get a cleaning 3-4 times a year?
Very important. Because as I was saying before, a patient can feel nothing and think that everything is fine, and it's not. Sometimes, most likely, this just sneaks up on you, and then you say, well, all of a sudden my gum started bleeding. All of a sudden my tooth became loose. But it's not all of a sudden. It's been going on until it's very advanced, is when you feel it. So preventative care is
everything.
Yeah. So that also goes with decaying teeth. If the patient brushes frequently enough, daily, twice a day at least, and maintains a pretty well-balanced diet, and particularly more so if you or sustaining your diet with supplementation, since we live in a polluted environment which depletes our nutrients. It's a good idea to supplement your diet with supplements, minerals, vitamin C. Vitamin C for gum disease is very important to prevent and to reverse as well. So this is what we do here. We practice holistic care by giving the patient home education, home care education, how to floss properly, how to brush properly, but also how to maintain an all-around good diet. Because the bottom line is not about flossing, it's about maintaining good health care. If you maintain good health care, then you really practicing health and preventing disease. And that really is what we practice here in our dental team.
Got it.
Office.
Got it.
So when you hear this scraping type of sound, it's because there's presence of calculus. And so we detect the calculus by sound and tactile. Sometimes you don't even see it. Depends on the level of the calculus. If you have tons of calculus, it's pretty obvious. But if it's just a little bit, then then you have to go by the sound and tactile.
It seems like you're going a little hard, though. I mean, you have to go with that much pressure?
No, the calculus is hard. It's like cement. So if you do it gently, you're not gonna remove it.
Mm.
But at the same time, you have to know the anatomy. The dental anatomy plays an important role when you do teeth cleaning without invasion. In other words, like if you do a dental cleaning and you know where the gum, with the unattached gum, which is called sulcus, that's where you go. You don't go beyond that, otherwise the patient would be screaming. I mean, you just go where the sulcus is. Sulcus is the space between the gum and the tooth, and you don't want to neglect cleaning that area because that's where the calculus can be.
Mm.
And if you don't remove it, most likely the patient can develop periodontal disease. First, of course, inflammation, because the tissue reacts to the presence of bacteria. So it's like fighting off the presence of bacteria, so it gets inflamed. That's an initial stage of gum disease, which is called gingivitis.
So when was the last time that he was in?
Seems like it was, I would think that it was about, from what I can remember, it was about probably a year and a half.
A year since the last cleaning?
Yes. Well, he's a very busy young man, so.
So you're going to work on him right now.
Yeah. And he's gonna have to come back pretty soon.
All right, I'm gonna cut it right there in 1 second. All right, let's see a little bit more. Yeah, you got some blood there too.
He really needed it.
Oh man, I can only imagine what will be coming out of my mouth right now.